Okay, so you've completed the treatment part of your first hospitalization. Now it's a little bit of hurry up and wait. We did a good job of giving you intense chemotherapy to kill off those leukemia cells. But as we discussed, your other blood cells, your white blood cells, your red blood cells, and your platelets also decreased as well. So we'll basically be watching your counts drop as expected. About 7 days after your last treatment, you'll reach what we call a nadir, or that lowest point of where your blood counts are. And then we'll expect them as your bone marrow recovers from the intense chemotherapy that it received, your blood counts will recover too. Each day we'll be getting blood draws to watch those blood counts. Oftentimes patients will have a chart in their room and their care team can tell them what their complete blood count or CBC showed today. But expectation is that about 7 to 10 days after your treatment is when you'll really hit that low point. As you hit this low point, symptoms also follow, which we'll talk about in just a bit. But this major part of count recovery while we're waiting is also to help support you through these different side effects that are expected from the intense treatment that you received. And at the very end, as we see your blood count slowly recover up to a more normal level, we'll want to take a second biopsy to see what exactly is going on in the factory after you received treatment. That will be an important part of this kind of whole first cycle of induction treatment. Okay, let's dive a little bit more into these side effects. So like we talked about, your red blood cells will decrease, and that can often lead to fatigue. But even just being in the hospital, receiving these different types of chemotherapy medications, not being in your own bed at home, it's multifactorial, but fatigue will definitely be a part of your journey. So we want you to rest when needed and as you can. But importantly, if you can take laps around your room or around the hospital floor, ways to stay mobile, working with physical therapy will be a really important part of your rehabilitation as well. We talked also about neutropenia, or the specific type of white blood cell that becomes low. And those neutrophils are the ones that help fight off infection. So again, being smart about hand hygiene, avoiding sick visitors, and an overall acknowledgement that you'll be at a higher risk for infection and fever. Another major side effect that can occur is mucositis or mouth sores. Additionally, sometimes mouth sores of the esophagus or kind of food pipe, esophagitis. Your chemotherapy that you're receiving, again, is doing a good job of killing the leukemia cells, but it can't tell the difference. So it's also killing off other normal cells. So the lining of your mouth, the lining of your esophagus, sometimes lining of your gut. So all of these types of reactions can lead to different side effects. So for mucositis, we'll use a special type of mouth rinse. We'll want to avoid spicy foods, can meet with a dietitian to help about eating softer meals. And this may also lead to great pain that does need to be controlled by stronger pain medication, like opioid medication. Our goal is just to help you through this process when the symptoms can be the worst. This is not a forever that you would need to be on pain medication. We want to make sure that we can help support you through this so that you can still eat by mouth and drink by mouth by controlling the pain. Additionally, nausea and appetite changes may help, additionally, nausea and appetite changes may occur. We have a whole arsenal of anti-nausea medications that are tried and true, that are well tested, and we use often with patients on chemotherapy, even preventive, during the chemotherapy and afterwards. Continuing to eat small, frequent meals and drinking fluids as best you can will also be helpful. There's other side effects that will likely occur. There are other side effects that can occur, and your care team will be very vigilant on your symptoms, asking how you're feeling each day. And we want to encourage you to be very transparent to tell them, because they have a major toolbox that they can use to help address any symptom that may come up during the hospitalization.